Hello, everyone. I want to thank Aotic for this privilege to present our abstract on the prevalence of cervical cancer dysplasia in North Central Nigeria, a 10-year review of cervical cancer screening at Bingham University Teaching Hospital in Jos. So I have no disclosures to make. Cervical cancer is the most common gynecological malignancy affecting women in Nigeria, with one woman dying from cervical cancer every hour. Cervical cancer is fortunately preventable and curable when detected early. And therefore, the World Health Organization adopted a strategy to eliminate cervical cancer by 2030. So despite availability of this effective screening and even treatment for precancerous lesion, screening in Nigeria and other low and middle income countries are largely opportunistic and hospital-based. And this study aims to look at the prevalence of cervical dysplasia among women attending Bingham University Teaching Hospital screening program. So we reviewed the smear results of women who had smears between 2010 to December 2019, and we classified the cytology results based on the Bethesda classification system. So data was analyzed using SPSS version 21. We look at bivariate analysis between age and cervical cytology display abnormality. So a total of 1,124 smear results were reviewed. The mean age was 43.8 with the range of 16 to 85. 78.8% were normal smears, 2.3 had inflammatory features, and 18.9% abnormal smear. So this chart actually shows the different groups, and we can see that the high grade is about 2.8% of the whole population, while the low grade is about 4.7. The other atypical cells constitute the remaining part of this bar. And we look at the age, this age 50 to 59 age group have the highest proportion of abnormal cytology. So we notice also that over 80% of the abnormal smears are aged between 40 years. And there was also association between abnormal cytology and increasing age. And we also found out that over half of those that have the high grade are within the age group of 50 to 59, which is shown on this in this table. Over 50% of that is in this age group. So high SIL, we know, has the progression rate of between 12 to 40%. And that is why high SIL, the high grade lesions are usually the threshold for treatment. In our own study, more than half of those with the high SIL are actually within those two age. And WHO actually recommends that screening should be done at least twice in a woman's lifetime. That's between the ages of 35 and 45. So the cervical dysplasia is fairly common at 18.9% among the results we obtained. So this study actually emphasizes the fact that even though well-organized routine nationwide screening is not yet implemented in Nigeria, and in most African countries and developing countries, we can also maximize opportunistic screening among women to also push the frontiers of eliminating cervical cancer globally. So thank you for your attention.